All right, welcome back, everyone. Today, we're diving into a full explainer on the latest clinical guidelines for a condition that affects millions of us, osteoporosis. Now, since you already follow the space, we're skipping the basic definitions and getting right to the good stuff. We're talking about a massive mindset shift here. Exercise for osteoporosis isn't just a good idea or some casual suggestion to stay active. According to the clinical data, it is literally a life-saving medical prescription. It's a precise, calculated intervention meant to rebuild your body's structural integrity from the inside out. Let's get right into it.
Now, what's really interesting about this concept is the distinction it makes. In the medical world, getting your FRAX score, which, as we know, evaluates your fracture and fall risk, is absolutely essential, right? It identifies the exact problem. It is the diagnosis. But, well, a diagnosis alone doesn't actually fix anything. As the clinical guidelines make incredibly clear, specific, targeted training is the actual cure. It's the definitive, non-pharmacological therapeutic solution. You identify the weakness, and then you prescribe movement to physically reverse it.
So here's our clinical blueprint for today's explainer. We'll start with why evaluation is just step one, then break down the big three pillars: bone strengthening, fall prevention, and fighting sarcopenia. And finally, we'll wrap it all up into the ideal weekly program. Easy enough, right? Let's move on.
Starting with Section 1, evaluation is just the beginning. This marks that absolutely critical shift from just identifying a risk to actively applying a real-world solution.
When we look at the clinical directives championed by experts like Dr. Christophe Delong, along with major organizations like the IOF and ACSM, they literally all converge on one undeniable fact: exercise absolutely must be multimodal. So what does that actually mean for us? Well, it means a single type of exercise just isn't going to cut it. To effectively treat osteoporosis, the program has to attack the problem from multiple angles all at once. We've got to reduce the risk of fracture by physically strengthening the bone itself, and at the exact same time, reduce the risk of falling by improving overall physical function. It's kind of like a two-front war, and a multimodal approach is literally the only way we're going to win it.
All right, moving to Section 2, which brings us to our first pillar, bone strengthening. Think of this as reinforcing the foundational scaffolding of a building. Bones are living tissue, and they actually need mechanical stress applied to them to thicken up and grow stronger.
Okay, let's dive into this. To stimulate that bone formation and really boost bone mineral density, especially at super vulnerable sites like the femoral neck and the vertebrae, the prescription is actually highly specific. First up, we've got weight and resistance training. Think light squats, lunges, wall push-ups, maybe some light deadlifts. You can use resistance bands or dumbbells, though, always under supervision at first. Second, and this is if the patient's fragility allows for it, we introduce high-impact stress. Things like gentle jumps on the spot, brisk walking, or climbing stairs. That applies the perfect amount of stress right to the hips and spine. And finally, postural training. We're talking back extensions against resistance and chest opening exercises to specifically counter kyphosis and relieve that built-up vertebral stress. Actually, let me just pause here for a second because I want to emphasize this with the utmost seriousness. Volume and intensity must always be progressive. For patients who already have a history of vertebral fractures, there are certain movements that are extremely dangerous and honestly must be strictly avoided. You absolutely must avoid heavy flexion and torsion of the spine. So no bending over to touch your toes, no classic abdominal crunches. Doing those movements can literally cause new compression fractures, which is the exact opposite of what we want. We're trying to apply safe stress to build bone, not break it. Which brings us to Section 3, Pillar 2, fall prevention. If the first pillar was about making the bones harder to break, this one is all about making sure you never actually hit the ground in the first place. And the clinical framework brilliantly illustrates exactly how we upgrade the body's internal navigation system. To improve neuromuscular reactivity and coordination, we focus on three main things. First, static and dynamic balance. We're training the center of gravity here. Standing on one leg, walking in a straight line heel to toe, or using unstable surfaces like thick mats. Then, functional walking. We want to improve reaction time, right? So practicing quick changes of direction, sidestepping, and deliberately stepping over small obstacles. Finally, core muscles. Doing adapted planks, even on your knees if you have to, stabilizes the whole center of the body. That's what prevents those sudden imbalances that ultimately lead to a nasty fall. All right, Section 4 introduces our third and final pillar, fighting sarcopenia. Remember, sarcopenia is that age-related loss of muscle mass. If strong bones are our scaffolding, muscles are the thick armor protecting them.
To really build up that effective armor, the clinical guidelines put a massive focus on the lower limbs. I like to think of your quadriceps, glutes, and hip muscles as the body's heavy-duty shock absorbers. These are the specific muscles that give you the raw power to push yourself up out of a chair or propel yourself up a flight of stairs. And, most importantly, if you do happen to trip, these are the exact muscles that give you the explosive strength to catch yourself right before you fall.
But here's the catch. A light, breezy effort just isn't going to cut it when we're fighting off sarcopenia. To build this protective armor, the training has to be done at a moderate to high intensity. Obviously, always as tolerated by the individual, that goes without saying, but intensity is an absolute requirement because it's literally the only way to force the body to generate actual muscle hypertrophy. We want real muscle gain and a real increase in muscle tone. So, let's move to our final section, the ideal weekly program. We've synthesized all three of those pillars into a highly practical, actionable schedule. The official clinical directives recommend running a regular program 3 to 5 times a week in total. And here's the exact breakdown. You want to do your resistance training, that's the bone building stuff, 2 to 3 times a week. Your balance and functional training, those navigation upgrades, should ideally be daily if possible. I mean, it can literally just be a few minutes a day of standing on one leg while you brush your teeth. And finally, layer in some aerobic activity like walking, swimming, or cycling to keep your cardiovascular health in check. When you lay it out like this complex medical prescription actually feels totally accessible, doesn't it? It's something you can easily reproduce in your own daily life. So, the crucial point is this. While this blueprint is absolutely the gold standard, it is not a one-size-fits-all kind of deal. The source text explicitly points out that this program must always be individualized by a healthcare professional. You need a specialized physical therapist or rehabilitation coach to tailor these exact guidelines to your specific frac score, your personal fracture history, and your unique fall risk level. They're the ones who make sure the intensity is dialed in perfectly and the movements are completely safe for you. Which leaves us with a pretty fascinating frontier to consider. As these programs become more and more sophisticated, what is the role of technology going to be? How will digital platforms like Kinexa, for example, completely revolutionize the way we track, manage, and continuously adapt these physical therapy programs in real time? That's the future of the fight against osteoporosis. And honestly, it's happening right now. Something to think about. Thanks so much for joining me for this explainer, and I'll catch you in the next one.